Hello, everyone, and welcome to today's webinar titled Understanding the Effects of Loss of a Parent or Caregiver from COVID-19 on Youth and Adolescents and Ways to Provide Support. My name is Kevin Sanchez, and I'm McSilver's Program Coordinator for TTAC. Today's webinar is part two of a two-part webinar series, and part one is available on our TTAC website, and I'll shortly chat in the link to part one for you to view the recording and resources from the part one webinar. And so just to move on, a few logistics about today's webinar before our presenter begins. As we've done in the past, this webinar is being recorded and will be posted along with the slides to the TTAC website. Additionally, you'll be receiving an email notifying you that these resources are available. We will be taking questions throughout the webinar, and we ask that you chat in your questions using the chat box functionality, selecting all panelists on the dropdown. We will set time aside at the end of today's webinar to address these questions. For those LMSWs, LCSWs, and LMHCs interested in obtaining CEUs, you will be eligible to receive 1.5 CEUs for attending this webinar. If you're only joined by the phone, we would need you to log on to the Zoom platform via a computer in order to obtain credits for the CEUs. Further information and instructions will be distributed via email following the webinar. Finally, towards the end of the webinar, we will be sending out our feedback survey using the chat box functionality. We ask that you click the link that is shared in the chat box and complete the feedback survey. We appreciate you filling this out, as it allows us to understand your experience and enhance our future TTAC offerings. And with that, I want to thank you for joining us, and I'll hand it over to Evelyn Blank, the Executive Director of New York Center for Child Development and Director of TTAC.
Thank you so much, Kevin, and welcome everyone. And we're really excited to be doing part two of this series, really focusing on the critical issue of grief and loss during the COVID-19 pandemic. And as Kevin had explained, our first presentation really focused on the young children, and the second is really going to be focusing on children and adolescents. Quickly before we get started, just a statement about who we are. The New York City Early Childhood Mental Health Training and Technical Assistance Center is funded through Thrive New York City, which is a partnership with the New York City Department of Health and Mental Hygiene. TTAC is a partnership between the New York Center for Child Development and the McSilver Institute on Poverty Policy and Research. Just a quick statement of who we are. New York Center for Child Development has been a major provider of early childhood mental health services in New York. We have expertise in informing policy and supporting the field of early childhood mental health through both training and direct practice. McSilver, our partner at NYU, Institute for Poverty Policy and Research, houses both the community and the managed care technical assistance centers, which offer clinic, business, and system transformation supports statewide to all behavioral health providers. And our goal here is to build the capacity and the competencies of mental health and everyone impacting on the lives of young children. And just, Kevin, I don't know if you could just go to a quick screenshot of our website where we would encourage people to go, where you'll find archived webinars and past presentations, including the first presentation done by Dr. Osofsky. So it is now my honor and privilege to introduce Dr. Joy Osofsky, who has been a true leader and a pioneer in the field. Dr. Osofsky is a clinical and developmental psychologist and holds the Paul J. Ramsey Endowed Chair of Psychiatry and Barbara Lehman Professor of Child Welfare at Louisiana State University Health Sciences Center in New Orleans, where she also is the director of the Harris Infant Mental Health Center. Dr. Osofsky has published widely related to both children and trauma. She is past president of the World Association for Infant Mental Health and of 0 to 3 National Center for Infants, Toddlers, and Families. And she is currently the clinical consultant on the leadership team for 0 to 3 for the Safe Babies Court Team program. I want to note that Dr. Osofsky played a key leadership role in the Gulf region following Hurricane Katrina and the Deepwater Horizon oil spill, and was also clinical director for child and adolescent initiatives for Louisiana Spirit following Hurricane Katrina. And so she's really been a sought out expert on her expertise in responding to disasters and the impact on children and families. She currently serves as co-principal investigator for the National Center for Traumatic Stress Network, Terrorism, Critical Incidents, and Disaster Coalition for Child and Family Resilience. And of course, she's received numerous awards in recognition of her significant contributions. So thank you, Dr. Osofsky, for coming back and presenting on this important key issue.
Thank you very much. It's a pleasure to be here. A pleasure to be with Evelyn Blank and the team. One of the best groups that I've presented with in many ways in terms of making it easy to do a presentation. And we decided that even though the New York Development Silver Institute and TTAC focuses a lot on that, considering what's happened with the COVID pandemic, that it's really very important to also talk about older children and adolescents. And if we could go to the first slide, please. So I always like to have a roadmap. And these are some of the things that we'll be doing this morning in the next hour or so. There have been some studies done on how much death of parent or caregivers has impacted on children and adolescents, and we'll be talking about that. And then what does it mean to have those kinds of losses? And then how can we provide support? And even though, as I say, the focus is often on younger children, adolescents play a very important role in the families and what happens with the younger children as well. But we also have to think about where the adolescents are in terms of their developmental trajectory and how this may impact them. And what are the expectations that people have for adolescents at this time? And what do they expect when they lose a parent or caregiver? And then how adults can support these children, recognizing the different developmental levels and taking into account cultural expectations. And on our way, on the roadmap, I would like to go to the next slide and then share a little bit more related to the context. So in the JAMA Pediatrics Journal, we see that one child under the age of 18 had one child for every 13 COVID-19 deaths, one child under the age of 18 has lost a parent. And this work has been talked about a lot. And interestingly, I'm presenting now in July 2021. A couple of months ago, it was 40,000 children who've lost a parent to COVID, and it went up to 43,000, and now it's at 46,000. And I'm concerned with a new variant that we may see many more of that. And 3/4 of these children were adolescents, which is one of the reasons we're talking about it today. And just to recognize that in a regular year, there certainly are loss of parents, but this is so much higher. And then if we go to the next slide, it focuses on some of the inequities. Black Americans represent 13.4% of the overall population, but represent 20% of the parentally bereaved youth and adolescents, as well as younger children. And this would not be the case if we had a more equitable, fair world with better healthcare and more equity overall. And we also know that within these families, there have been economic difficulties, uncertainty about the future, ways to control the virus. Fortunately, we have vaccine now, which is playing a very important role. And early on, with a couple of colleagues, we talked about the long-term social and psychological impact of COVID, and also the inequities. And I think it's really important for us to think about this at this time. If we could go to the next slide. I want to take a look at the developmental expectations, and I'm going to put this into context. And I'm sure many of the people listening today know people, maybe in your own family, where there's been a loss of a parent, a loss of a caregiver. And as I was developing this, and as I talked about the importance of doing this, I realized from a personal point of view it has a lot of meaning to me. I lost my father suddenly when I was 6 years old. The sudden death, no warning or anything like that. And I remember it to this day. And so one of the things that you'll hear that I'm talking about a little bit on my own experience, but that's what it says in the literature too, is this doesn't go away. This can impact on other aspects of your life as you're growing up, the different kinds of things you miss, how you fit into the world, the meaning. And in my clinical work, it takes me back to a number of cases we've seen. We started out with some little 2-year-old boys who had lost, it was a homicide situation, but they lost their mother due to the shooting death by their father, and their father went to prison, and they went to live with their grandparents, and that's when we started to work with them and saw the different developmental issues for them. And even an understanding or lack of understanding in many ways of a 2-year-old in terms of what happened, but then what happened with them over time. And I remember very well the clinician who was working with them, and I was a supervisor, stayed in touch with them. And I remember what it was like for them as adolescents. I remember what it was like when their grandmother became ill. And I remember what it was like when she died, when they were about 8 or 9 years old. And then their grandfather died when they were teenagers, and there was nobody there for them. And they had to try to find their way. And that's what we're facing now. And that's something that we need to think about and talk about in terms of how to help support these children. Next slide, please. So with the 7 to 12-year-olds, we know they need routines. Adolescents need routines. We all need routines. And they're going to ask a lot of questions. And people should be available to talk to them. They're going to ask about why masks are worn. They've been asking about that. Now, there have been rulings that we don't have to wear masks, and that has to be explained to them as well. When the really young children, we know, play it out. They play it out in, they play doctor a lot, they play ambulance a lot, all of that. And the children who are a little older, we still see some repetitive play in them, and they ask a lot of questions. We also see regression in the older children. They may be much more clingy, and we don't usually see 7 to 12-year-olds wanting to stick by their parents, but we see that now. And again, just as we say with any disaster, just as we say early on with COVID, and now frankly with the new variant, be careful with media. It's very anxiety provoking in general. Let's take a look at the adolescents and what they may be thinking about. So they surf the web. They're on their own to learn about COVID and to learn about what's going on, and they hear a lot about it, and they probably worry about it a lot. So it's really important to be available to them, to listen. And we know adolescents stay on their own. However, it's really important to figure out a way to do that. I have a good friend who has 2 teenage twins, and we talked a lot during COVID. And they stayed in their room a lot. They didn't come out a lot, but she would check in with them periodically, just not to bother them, just to make sure everything's okay. And they always knew that she was there to listen to them. And that's so important with older children. And the other thing that we found very clearly after our work with disasters is involving them in some ways with recovery, involving them in some ways with helping in the family. If maybe helping as it's safe to shop for supplies. I know that some adolescents have helped older people who couldn't go out due to safety, and different things that they can do. Maybe they can plan a meal each week, watch the younger children. They'll be aggravated sometimes being at home related to not being able to go to school and be with their friends. But we found that teenagers did a lot if they were involved some ways with recovery after disasters. And here we have a different kind of disaster, but it's really important for them to be involved. And as you can see, to be valued anxiety. And they're difficult. It's difficult with talking to them. They may not want to talk, But it's really important that parents and caregivers know what they're doing, how they're feeling, be there to listen to them. If we could go to the next slide, please. It's very important, and this was something, as I was preparing this, and I mentioned early that I had a parent loss when I was 16, a sudden parent loss. As I was preparing this, I kept thinking about this. This is many, many years ago, but it doesn't go away. And what happens is you miss out on various occasions in many ways. And teenagers have had so many losses now that are going on that a loss of a parent just makes this so much more, has such a great impact on them. So we know that schools have been open and schools have been closed, but they're not around their friends. And they really, adolescents, older children need to be around peers. It's a time we know for development that it's so important. The routines change constantly. They're not able to see family. Now with the vaccines, we're seeing more of this going on. And you see, I don't know if people follow Facebook or other kinds of things, but you see these wonderful reunions. I was very fortunate 2 weeks ago to be able to have a reunion with my older son and his two children, who I hadn't seen for a year and a half, a 3-year-old that I hadn't seen since the child was 17 months old. And older children and teenagers need to be around family. And what about birthdays and sporting events? And for the teenagers, the older teenagers, graduations and other celebrations, how to do that. And we've all read about creative ways that's been done, but from a developmental point of view, they are really important losses for them. And then teenagers, adolescents who are getting ready to leave home, or trying to leave home, or trying to go out on their own, or having a job. All of this has interfered with that level of independence that they need to have developmentally at this particular point in time. If we could see the next slide, please. So all of these different aspects contribute to mental health issues. We've seen since COVID at various times, and we have not seen an increase in people seeking out mental health services. After disasters, a natural disaster or attack, we reach out to people, but that's one of the things that's been prohibited with COVID is that usual support network for children and adolescents, as I mentioned before, families and friends, and then school, teachers and counselors. And just to mention something that we know has occurred, we haven't seen an increase in the statistics in child abuse and neglect, which refers more to younger children. Not older children aren't neglected and abused, but the higher numbers are in younger children. And one of the reasons is that not as many eyes are on them. And that's really important to know. And then just from a policy perspective, we need to think about what to put in place, what kind of interventions to put in place where we can reach youth and adolescents, even if it's just being available to talk to them, would be incredibly important at this point. If I could go to the next slide. So in early data on high school students and continuing, then 25% of high school students reported worsening emotional and cognitive health. And over 20% of parents with children ages 5 to 12 reported similar worsening conditions. Now, we also know there's an increase in anxiety and depression among parents as well, which probably contributes to what's going on in the children. But this is really concerning in terms of needing to reach them and help support them. And as you see, I have that bullet point there of decline in mental health care usage. On one hand, I've heard from clinicians that they have fewer people canceling because all of us been doing our work virtual during that time, the majority of virtual. But why is there a decline in mental health care? And one of the things that really needs to be done now is somehow reaching out to children and adolescents and younger children as well. And a place to reach out for them is schools, and for the younger children, childcare and daycare, that's where we're going to be able to reach them and provide that kind of support. And we also need to think about how to reach the parents. I was mentioning earlier to Evelyn Blank that we're consulting with a number of school districts, and they've asked for support, training and support for what's, a way to help them and the children, for the staff, for the teachers, for the administrators, as well as support for the children. So that's something that we've done following other types of disasters, and it's really very important now, because we have to address the parents' mental health issues as well to support the children. If I could have the next slide, please. So if we're the Kaiser Family Foundation, and you can look that up and see some of this data, has surveyed people, adults and children, continuously during the COVID pandemic. And the figure of 25% of high school students reporting more concerns about emotional health is really striking, and I think something that we need to pay attention to. And part of it was, in a recent survey, they felt they couldn't cope with the sources of stress. Their strained peer relationships, they didn't have the kinds of things that help them feel whole and feel supported. And a third of them talked about that. That's a lot of children. And again, frequent diagnoses, that's what we're seeing, an increase in anxiety, depression, adjustment disorder. There's also been, as we know, an increase in substance abuse disorder. There have been more overdoses. There's been more relapse going on. And we really need to think about addressing these issues, because substance use disorders certainly occur in the older age group that we're talking about. And I'm struck on this survey that a third of them felt they were unable to cope with all of the stress, and how could they get support. But if they were in a school setting or out in the world, somebody would pick this up and there would be much more support for them. So that's something that we need to think about moving forward, and we need to think about as schools reopen. It's going to be very, very important. Next slide, please. So there was a recent article in the New York Times, since I know many of you are in the New York area, talking about emergency room visits. And starting in April 2020, which is just a month after the lockdown, there were many more visits, child adolescent mental health visits related to concerns about all kinds of things. But compared with 2019, proportion of mental health related visits for children 5 to 11 and 12 to 17 increased approximately 24% and 31%. So we generally think of people going to the emergency room for other types of things, but you can see the increase in mental health issues. And there are long delays, of course, in emergency rooms. There are fewer inpatient beds. So one of the things that one of my colleagues talked about, Dr. Mary Margaret Gleason, if anybody saw the article, was we need to start earlier in doing more of this prevention, because we think of the emergency room being used for other reasons than mental health concerns. If we can take a look at the next slide, please. To go on a little bit more in terms of emergency department visits, you can see that there was suspected suicide attempts for 12 to 25-year-olds. So we're out of our range a little bit before and during COVID-19. And it's important to look at the previous data to understand what this might mean. Between 2007 and 2018, before the pandemic, there had been an increase in adolescent suicides annually. I consulted with some psychiatry colleagues to check out this data. Second leading cause of death among 10 to 24 years old. So we're going into a little bit older people, older beyond adolescents. And during 2020, as we had that year of the pandemic, pretty much a year, The mental health related emergency department visits among adolescents 12 to 17 years increased 31% compared with 2019. So we have these suicide attempts coming out, not actual suicides, but people are, the adolescents, the children are really concerned, and their parents are concerned. Right after lockdown on social distancing, the visits for suspected suicide attempts began to increase among adolescents. People felt desperate. You know, they're on lockdown, they can't be with their friends, there has to be social distancing, there has to be mask wearing, and parents are concerned about the children. And, you know, mental health services are harder to access, they go to the emergency department. And then if we look at continuation of that data, February 2021 to March 21, suspected suicide attempts were over 50% higher among girls. And that much higher than 12 to 17-year-olds during the same period in 2019 before the pandemic. For boys, it increased 3.7%. So the suspected to a suicide attempt are higher for girls, much higher for girls, and that's generally the case. But it was more pronounced here. So we're seeing that young people are feeling desperate, you know, when they maybe threaten. Again, it's not suicide, it's a suicide attempt, and parents become concerned and they take them to the emergency room. But why is all that happening? People feel confined, you know, they're isolated, they can't be with their friends, schools are closed, there are no other kind of supports for them. And so they're taken to the emergency room to get some kind of support. And we've heard that from many of the child psychiatrists who work in our children's hospital, that they've seen this kind of increase going on. And that's one of the reasons we talk about how important it is to be available, emotionally available, and talk to the adolescents. If we could go to the next slide. So how do we understand what's going on in adolescence during this period? Erik Erikson, a psychoanalyst, a major scholar, I'm sure many of you have heard about Erik Erikson, talked a lot about what goes on at different developmental stages, and he talks about adolescence as a critical developmental stage. So a critical developmental stage to be with your peers, to interact in various ways. So the pandemic, we're not allowed to be near people. Certainly a lack of normal interactions and supports. And that's what teenagers need. You know, so that critical developmental stage, they're not able to go through the process that's so important to them. So the other thing with COVID is that it may bring up other experiences, difficult experience. We call it trauma triggers. When I was talking earlier on related to a death early on and my experience of the death of my father when I was 16, it triggers the pandemic triggered it, all of the deaths that are going on, and that goes on for people and other difficult experiences they've had, whether there's a divorce in the family, whether there was a death previously of a grandparent or something like that. The changes with COVID will trigger these experiences, which may be contributing to what we're seeing in terms of people asking for help. It's really, really important to listen to adolescents. And also, if one is around teenagers, and certainly for parents or grandparents or caregivers, just going to say, if they're concerned, what else is going on now? You know, are there other things going on? Do you want to talk about it? I'm here to talk about it. And everybody who's listening, who's been around teenagers, either has a teenager or works with teenagers, knows that this is really important to try to keep those lines of communication open. Encouraging virtual relationships. You know, one of the things that we haven't seen that much written about, but I'm sure all of you have been thinking about, is we always want to contain use of media by children, by adolescents, and not be on the screen all the time. And yet we've had to be on the screen during the pandemic. And those virtual relationships have been so important. And we've had to encourage that because that's what we all need. And then for parents or caregivers, what does this mean for them? They may have their own issues, their own emotions and worries, and they also can get triggered, and this can be reawakened by what's going on in their children. So one of the things that I emphasize that's so very important, it's important for children of all ages. It's harder with teenagers because they don't often want to talk, they want to retreat. But it's really important to listen to them, to just sit down and listen to them or be in the room with them, and then eventually maybe they'll say what's on their mind. Helping them to find meaning and purpose as they're missing all of these usual things that occur at this stage in their life, and experiencing death of caregivers who are very close to them. Next slide, please. One of the things that we found during disasters, as I mentioned before, was engaging the teenagers. So one of the things after Hurricane Katrina, we worked in communities, school districts, every school was destroyed. And there wasn't anything particularly for the teenagers to do. There wasn't anything for the younger children to do either. But teenagers find a way that they can get into trouble easier than younger children. So just an example, in this, they had 3 high schools, and one part of one building was left standing, the upper part, and they put together school there. And one of the things that the children had a garden with the community. They also helped the younger children. They also planted trees in the wetlands. And if there's some way to engage teenagers in family responsibilities, maybe making a meal, watching or playing with younger children, they're not used to having their younger siblings at home either. And then that regular weekly check-in, which is so important. Check in, let's see what's going on with COVID now. What other information are you getting? Maybe you know some things I haven't heard. Maybe we should talk about it. Just in a relaxed way to just stay in tune with what they're hearing and what's going on with them. And they may be really worried about parents becoming ill, parents becoming ill. I know that we had a 13-year-old we were seeing who was in virtual schooling, and he would benefit a great deal. There was a school that opened and he was going to be able to go back, and he refused to go back to school because he had lost his grandparent, and he was afraid if he went back to school, he might bring the virus home and somebody else would get sick. And we see a lot of that going on with older children, and we need to pay attention to that. Next slide, please. With younger children, I often talk about red flags. And I guess maybe these are red flags for the adolescents. We need to monitor mental health and see what's going on. There's a lot of fear of the unknown. I've been talking about this indefinite uncertainty, and frankly, it's continuing. Even though we have vaccines, we're now having a variant, so there's some more of this indefinite uncertainty, fear of the unknown. When are they going to be able to return to school? So some of the things to look for: sleep problems, and many of you have probably had sleep problems. I know I've had sleep problems and nightmares, but if this is continual, we know adolescents and teenagers have different sleep patterns too. But at the same time, if there's something different going on, if they're eating issues, eating more, eating less, if there's any signs of self-harm, or some behaviors that they're acting out more than usual and not willing to talk about it. If they're isolating, so you have the externalizing and the internalizing more than usual. And then even though they may not be able to be with their friends, they certainly can share with them and relate in different ways. And if that's not happening, so these are all kinds of things to look at in terms of monitoring mental health issues and seeing if you're going to need to be able to reach out in some ways, and if somebody needs to reach out to help them. Next slide, please. So this is some more of the Kaiser Foundation work. I found this kind of interesting in the past year for 12 to 17-year-olds where they received mental health services. And we see that most of the services they got were in some specialty mental health setting. And then there were some in educational settings that opened. And then some general medical settings. One of the things that a lot of us feel is mental health people feel is very important now is to reach out to pediatricians. That pediatricians, just like the emergency department, is going to be where children and families come. And pediatricians, I know they pay attention to mental health issues to some extent, but really need to pay attention to it more. At this point, this is going to be a place where we're going to be able to reach children and families and help them at this time and do more preventive type of work. Next slide, please. So the risk factors that we see in the next slide with a loss of a parent or caregiver are traumatic grief, which we would anticipate, depression. And then if we look at some of the kinds of things that will impact on poor educational outcomes, we see poor educational outcomes in children, youth and adolescents who've lost a parent and doesn't have that parent there to support them. Unintentional death or suicide, that's rare, but something to work out for. And again, without needed support interventions, the consequences can persist into adulthood. They're missing all of this time with a parent or caregiver, and it impacts on them later on, and again, can be reawakened. And so that's something that we need to be aware of, and that's a reason to address it now. Next slide, please. I want to bring up again the issue of inequities with losses. Census Bureau said that 23% of all American children live in single parent households, with the number being over 62% in the Black community. So Black children are at increased risk of being left entirely without parentals, lose their sole caregiver. And more Black children, about 8%, double the number of white children are being raised by grandparents as the primary caregiver. We also know that the elderly population has been impacted more with COVID deaths. They represent 80% of the COVID deaths so far. So those children who are dependent on grandparents are even greater risk. The family, the young boys that I talked to you about earlier had lost their mother, and their father was in jail, and then lost their grandmother, and then lost their grandfather, because those were the caregivers that they had in their lives. So that's something that we need to look at, is that increase in loss with children who are being raised by grandparents. And we need to pay attention to that, and we need to give them more support. Next slide, please. So there are other factors that can contribute to poor mental health. We know that there's been a lot of financial and material hardship in families. These are families who are struggling with inequities to begin with. And we also know that the caregiver distress and mental health issues will impact on children. So we need to think about ways with this indefinite uncertainty to have some predictability, some routine, some schedule, so that we can decrease some of that stress and anxiety. And I know it's going up now. It's going up now with this new variant. And people had raised parts of Louisiana has been one of the states that we know there are areas that are higher risk. Fortunately, New Orleans, we're at a high level of vaccination. A lot of high percentage of people in New Orleans have been vaccinated, so it's very safe, as safe as we can be in this part of Louisiana. But to the north and to the west, it isn't, and that's the case with many states right now. So this continues, leading to increased stress and increased anxiety. And one of the things we found as mental health providers is people who were able to manage their anxiety before COVID are now returning from services because there's been so much pressure going on that they can't manage their anxiety anymore without additional help. If we could go to the next slide, please. So one of the things that we know is very important in terms of helping at this point is some ideas of what to do. One of the things that people have said to me is, what can we do? How can we help? What's going to make a difference? And how can we help these older children and teens who are grieving now? So one of the things that's going to help a lot, and we've worked a lot with schools, both at younger children and older children in schools after disasters. After Hurricane Katrina, we helped out colleagues in Texas after Hurricane Harvey, major disasters, other major disasters. And we know that engagement in school, engagement with teachers, engagement with peers is going to make a difference, and it's going to help a great deal. And as much as we can do that to keep everybody safe, I know some older children, 12 and older, have been vaccinated, which will allow them to be safer. So the younger children aren't yet vaccinated, but that's something that will make a big difference in terms of them being able to be around their peers. And that's going to be a protective factor for them. The other major protective factor is those face-to-face encounters with teachers, counselors, and extended family and other people. That children and adolescents, just like all of us, we need to be around people, and that's going to help after the loss. And we shouldn't just ignore them and say, oh, they're going to be okay, they'll take care of themselves, because they need help and they need support and they need someone to talk to. And unfortunately, we often don't think about children at that time, and we need to think about that now. And the other thing that's going to be very, very important is to embed mental health services in schools, places where children are, in community centers where children may be, in religious institutions where children may be, and embed them in a way that, you know, you don't have to point to the person and say, oh, you need help, something like that. But we found with our experience of embedding services in schools that often the young people who've received some services will say to their friend, hey, I used to be like you, but you know, you ought to go talk to this person. So they actually help with other people getting the services that they need. And also, it's not designated as this person has to go for mental health services. There's support available. They can talk to somebody. It's part of one in a day, and it's really needed now. We learn very much from schools after disasters that it wasn't very hard to embed mental health services. The educators often feel we just want to get back to teaching the kids. We just want to get back to education. But I can tell you in our work in this past year, we've done a number of surveys through some of our work with the National Child Traumatic Stress Center, through a center that we had. We've done surveys of teachers and administrators in terms of how they are feeling and what's going on in their lives and their thoughts about school reopening. And they're very concerned about the social and emotional development of the children. They're also concerned about balancing their own family at this point. But we also know that by just being there, having a mental health person available, as opposed to having to go out and find services, makes a huge difference in terms of helping children and families at this time. Next slide, please. So what can help now and how to move forward? Significant day-to-day support needs to be in place. And I talked about how to put it in place in schools, but also recognizing that adults need to take care of themselves. In order for any of us to be emotionally available to somebody else, we have to be feeling pretty strong within ourselves, or at least pretty secure. So self-care for adults, whatever kind of care that is, if it's talking to a friend, if it's meditating, if it's taking a walk, but something so that we're able to contain ourselves enough to then have these difficult conversations and be available in that way. I've talked a lot about schools, religious institutions, cultural traditions, community supports, and hopefully now with availability of vaccines, we'll be able to have more of that in place. And then reaching out for help. You know, one of the things that unfortunately we can't do as mental health professionals, you know, a lot of what we did after disasters was, it doesn't sound like a very professional term, but we used to hang out. We were there. And sometimes people wondered why we were there. But then when something was bothering them, they talked about, they talked to us. When we were on the boats that were cruised, that were docked at Julia Street Harbor, and every day when I got on the boat, there was a police officer there, and I would always say, how are you doing? And how he answered or she answered was really important. And I said, I'll be around. You know, if you can give support to people that way, it's really very, very important. And I noticed someone said how how to talk to the children, see where they are. Even that comment I made before is, how are you doing? How are things going for you? Or even talking with them about, for the older children, what they know about COVID now, what their thoughts are. Do they have any concerns? And being open to listen to them is really important. Next slide, please. So, because of the extent of the mortality, to think of that 46,000 children who've lost a parent or grandparent, we really need to find a way to give them more support. And families, with economic issues and other issues, it's very hard to deal with all of that. And so there needs to be ways to think about it, ways to provide community support too under these circumstances. And there's a lot of hope now with the vaccine of being able to provide more of this support. But because a teenager isolates themselves and doesn't want to talk and stays in their room, it doesn't mean that they don't need support. And as I said, this friend of mine, a teenager, she would just pop in the room, put her head in, how you doing? What's going on? And she would look at what was going on. If they look more concerned or they, their mood or other kinds of things. And that's one of the things that's so important, is just to stay in touch. And, I know a lot of you, have raised teenagers or around teenagers and know that they're not often forthcoming. Sometimes you just have to sit there and figure out when they will be. And that's not a very professional way to do it, but they not to misinterpret their response. And, even share, this is pretty hard, not being able to be with friends. Let's see what we can do to make it better. Anything we can do to make it better. And they'll go back to their computer or they'll go back to their corner, say, well, I'm going to hang around here. Something like that. Next slide, please. It's also important to think about all of the other losses that have been going on. And I talked about some of this before, but it's really important to look at it at this point. We can establish new routines. We've had to continually change our routines and establish new routines. And it's important to talk about that and be able to think about that together in terms of establishing routines. It's possible now to see friends and families if one's been vaccinated. And that's going to be a big help for everybody. In terms of routines, now more availability of vaccine, at least for adults and for children who are 12 years old and older, it may be that those routines will be different now, and important to think about doing that. And also, people have been able to start celebrating occasions together. So I think talking about it is going to be really important. If we think about what parents are going through their own issues. There's been loss of job and loss of income, very often working at home, homeschooling of children, and then a lot of fear and uncertainty. So for adults and parents, things are different. And so what we need is a way to support adolescents under those circumstances with the new routines, supporting them going back to school, being able to maybe be with friends, and talking about, someone said, how do you talk? Talk about the fact, yes, we all miss being with our relatives. I can tell you, in my family, I'm very close to my grown children and my grandchildren. But in my family, we gave them what we call roots. We're very, very close family, but we gave them wings. So, I have family that lives halfway around the world, and we've connected virtually, but, we miss very much being together, and we talk about it. And it's really important to be able to do that, to talk about it and find ways to connect. And for adolescents, meeting with them virtually at this point, and hopefully at some point being able to see them in person. But for teenagers, they also don't like the younger siblings being at home sometimes, but life is just different for them. And teenagers really want to be able to control their life. And during a pandemic and during a disaster, they cannot. And so we have to think about not just school being closed, but all of the additional losses that are going on. And then little by little, as we get more vaccine, as we can open schools safely, being able to support them in different ways, which will make a difference. Next slide, please. So in May 2020, with 40,000 people who were surveyed, 34% reported symptoms of either anxiety or depression. And then later in June, 40% were struggling. And symptoms are higher in women. Symptoms are usually higher in women, younger adult essential workers, and racial and ethnic minorities, and that makes a lot of sense. Let's go on to understand where some of those mental health concerns may come from, and with the next slide. This whole idea of ambiguous loss, what do we mean by ambiguous loss? First of all, we have life. You know, no one who's listening in, none of us have gone through a pandemic before. Certainly we've been in situations where we aren't able to see friends or visit families. There can be illness, there can be family living far away, so there are financial issues that get in the way, but we've never been in a situation like this before. So we have to find ways, you know, whether it's a telephone call, a 5-minute telephone call, you know, we don't even have to use media, can really make a difference. Other ambiguous losses, loss of high quality education or overall education, having to have virtual education, modified openings, uncertainty now about safety. Schools are going to open and there's still some uncertainty about safety, and people are going to have to deal with that. And it's not just the students, it's not just the parents, it's the teachers and the administrators as well. And then loss of many rituals. And one of the things that I noticed very early on here, I'm originally from New York, but I've lived in New Orleans for a very long time. And one of the ways that people in New Orleans celebrate actually a death. They celebrate with a jazz funeral. It's a tradition, it's a cultural tradition. And it's a way that they bring family together. And there are other cultural traditions that people have. And they've talked about, many families talk about how hard it is not to be able to have the jazz funeral. Actually, as vaccination levels went up in New Orleans, one of the first things I noticed was there was more music, that people were out playing music. That's something that's part of a tradition. And there are other traditions. And if we can get back to some of them little by little, it will help with these ambiguous losses, all of the other things that have been lost in addition to death. If I could go to the next slide. So one of the things we've talked about also is COVID deaths have been unpredictable. People get sick, people go to the hospital, and people don't return. So there's now I know that sometimes one person may be able to be with someone who's ill, although you need to protect people as well from not getting COVID. But when there were so many losses, there was no opportunity to say goodbye. There's no planning, none of that. And that's very traumatic. The death is traumatic, but also not being able to deal with it in a quote normal way is really hard. When I mentioned earlier on with my experience of the death of my father, it was very sudden. And there were traditions that the family played out. I was actually left out of most of them because I was a teenager and they thought I shouldn't be a part of the tradition or something like that. It's actually influenced me a lot in what I'm thinking about now and how to help children, how important it is to be able to do that. And this complicated bereavement with COVID needs to be talked about with children. And, you know, they often are overlooked. There are plans that have to be made. There are other things, and they're often left out of discussions and planning. But right now with COVID and everything that children and teenagers have been through, they cannot be left out of the discussion. They really need to be able to be included in plans that are made, and how we deal with my next slide, bereavement and grief. If we could go to the next slide. How do you share grief, and how do you recognize the passing of a loved one? And different families have done it in different ways, but it's been a really, really hard situation. And for children who now have lost a caregiver and do not have anybody to be there for them, it's really very, very difficult. One of the things we know is that physical contact is very important, but we haven't been able to have physical contact. So we need to think of ways to support children with grief and loss. Next slide, please. So grief is a normal process. We all heal from losses over time, but it includes strong emotions and shifting the focus from real to remember and internalizing and holding the good. So with younger children, we talk about different ways of drawing pictures or writing a message, but older children could write a message also. One of the problems also with older children is they wonder if there's something they did that may have contributed to the loss. Young children worry about that also, but older children really do, you know, because older children and teenagers have very strong emotions, and they may have had very strong emotions related to this person who they lost in the last day or two, and then they'll feel very guilty. So being able to talk about that and be able to understand that they didn't cause the death, and that we will miss the person as well as them missing the person, will be very important for teenagers. Next slide, please. Responsive, supportive caregivers are needed. If caregivers aren't taking care of themselves, it cannot be available. And I talk about emotionally available, not just being there. And I know it's really difficult, but then for the adolescent, they have the loss of the person and the loss of support. So we really need to think about supporting caregivers. It's not a luxury, it's a necessity for caregivers to support themselves and find ways to support themselves in order to be able to support other people. So the next slide talks about what can we do. Next slide, please. Express how you feel, express your emotions. They need to know. What I talked about was expressing them. I have talk about how you feel, how you're going to miss the person, the activities you did together, and then encourage them to do the same. You can share your emotions. You don't have to hide them, not overwhelm them with it, but, you know, I have feelings about it, and maybe feelings about it too, and talk to you about it. And that will be really supportive of the child or the teenager. And then age-appropriate ways. And then essentially listening to them, what they like to do with the person, and how they're going to miss what they were doing with them. If we could go to the next slide. Adults can be overwhelmed with their own grief and loss, and that can interfere with them supporting you. And it's important to think about where the teenager is developmentally, and just sit and talk to them, ask them their feelings about the person. If they have guilt, and you know, maybe they had a bad feeling, but that didn't influence them dying, and that we're all going to be in this together, and we're going to work together and help support each other, and that you will be there for them to listen to. And not leaving them out of the whole situation. And that can happen if adults are preoccupied So maybe the adult kinds of support from themselves so they'll be able to do it. The worst thing, maybe not, certainly not a very positive thing you can say to a teenager is, "Joe, get over it, get on with your life." It's terrible to say to anybody, get over it. We really need to talk to people and be able to hear it and be able to hold it. And that's why it's so important for the caregiver to get support. They can share their pain and their sadness, ask the adolescent to support them, but say we're all feeling this and we're in this together, and let's see how we can support each other and move through it. Next slide, please. The additional worries that go on, it seems really unfair. It seems very unfair. And then they may worry about what will happen to them or what will happen to surviving loved ones or others in the community. Adolescents may worry a lot about other people getting sick. We've seen that a lot already. And so they need a lot of support that they're not causing it, that they're not doing it to people, and that the scientists are doing everything they can to keep us safe. We know that the vaccines work for people who are having the vaccines. But they may feel like maybe they could have done something. Maybe they went out and came back and brought the illness to this person who died. And they really need to be reassured that precautions are being taken, that masks are being worn, that social distancing, and that they didn't cause the death. And that we're all going to get through this together. That's a very important way to talk to the children and support them. Next slide, please. So the most important protective factor for children that we'll see on the next slide is a committed, available adult capable of sensitive, responsive, reliable caregiving. We talk about this protective factor for younger children. It's also a protective factor for older children, somebody who's there, who can be responsive, who can listen to them. That will, we know, to build resilience in children or adults, that protective factor is the most important one. And if it's possible to have involvement in cultural traditions that are developmentally appropriate and rituals, that will really be helpful. I very much encourage, particularly now when one can move around a little bit more, developmentally appropriate explanation. For they understand the permanency of death. Younger children do not, but older children do. And my internet connection is getting unstable again. So I hope you can hear me. And then creating a climate that gives permission to feel, maintaining schedules, routines, and rituals are very, very important. What to expect of consistency. Next slide. Okay, we have 2 more slides. If I can go to the next slide, please. Next slide is about self-care. Self-care for caregivers is crucial. And perhaps one of the most important factors in supporting children to the death of a loved one is being able to be emotionally available, which takes self-care. Parents and caregivers need support, and virtual support is better than no support at all. So calling up a friend and saying, I'm having a hard time is really very, very important. And I want to make sure that you see my next slide, because I was thinking a lot about what to have as my last slide, if you would move to the last slide. So we all remember the inauguration in January of 2021, and Amanda Gordon, the youth poet laureate, The Hill We Climb. And this statement that you made, I took this quote from her talk because it seemed to be very appropriate for what we're talking about now and very meaningful. So while once we asked, how could we possibly prevail over catastrophe? Now we assert, how could catastrophe possibly prevail over us? And that's what we need to do going forward. And that's how we're going to support ourselves and the children, adolescents, and as I talked about last time, the younger children. With this statement, how could we possibly prevail over catastrophe? and now saying for us. Resources, if you would go to the next slide, and you can show the resources to everybody. There's this resource related to talking to an adolescent about death, how to help young people deal with grief and loss. That's from a colleague of mine from the Clay Center in Boston. And I also put our 10 considerations for mental health professionals working in schools following COVID. So I apologize for the internet problem. I don't know that I've had so much internet problems before. Things have gone very smoothly before, so there must be something going on between my internet and yours. So I wonder if we have time for some questions.
Absolutely. So let me start by thanking you for sharing your expertise, and again, apologize for all the connectivity problems here. I wanted to remind people to please do fill out the evaluation in the chat box. We very much welcome and look to your input in terms of shaping upcoming trainings. And also, if you have further questions, please put them in the chat box and we'll try and get to all the questions. So a few came up. First of all, what suggestions can you offer schools for how to help kids return to regulation this year?
Please repeat it.
Yes. What suggestions can you offer schools for how to help kids return to regulation this year?
Well, first of all, as we know, the environment has to be for the children. And I know that's an issue in some older schools, and that's being taken care of at this point. But also, I was talking about, there has to be school administration and teachers in terms of where they are, and providing some support for them so that they're going to be able to be available to the children, to support them, to recognize when there's an issue. One of the things that I had mentioned before about if it's possible to embed mental health support where people would coordinate with CAST, is we have a screening, we've developed a screening that they can have students fill out, the older students fill out, parents fill out for the younger students, so you have a feeling of where the children are from the perspective and from the concerns. And then for children who seem to need more support, you're able to identify them. And obviously no supports are given, mental health supports without parental consent, but building in support for the school overall is important. Teachers and administrators have asked us for training about what to expect, training about how to support children following disasters, training related to how to help children who may have experienced death and grief and loss. So those are some of the kinds of things that would be really important. But starting that conversation with school administration now, also concerned about going back and support their own family as well.
Thank you. So someone asked the question, they were wondering if you could share some specific ways to speak with kids worried about returning to school or other venues due to worry about bringing the virus home and losing parents, caregivers.
Kind of question for them is, say, how are you feeling about going back to school? You know, do you have any concerns? Anything we could talk about? It's going to be fun to be with your friends, but you know, you may have other things on your mind. And so if they bring up the issue of I'm concerned about bringing things back, they need to be reassured that schools are taking safety precautions. I believe most teachers have.
So it looks like we're having some trouble reconnecting. For those of you who chatted in questions, we will try and respond to you via email. We really appreciate your interest and your questions here. And again, thank you all for joining us. In a few days, we will be posting the webinar along with the slides, and hope that you will all have the opportunity to access it. So thank you, everybody. And I think we'll end for today. Thank you.